Hi everyone, I'm Dr. Min Sun. I'm a medical oncologist. I work at the University of Pittsburgh Medical Center, Arion Cancer Center in Pittsburgh, Pennsylvania. Also, I'm a consultant and the chief medical officer for Arion Cancer Center in Beijing. So my practice is focused on solid tumor, especially breast cancer. My research focus is mainly in biomarker discovery, especially using artificial intelligence to explore genetics, proteomics, radiomics data to improve diagnosis and treatment. We also use ctDNA and circulating tumor cell as a liquid biopsy approach to monitor treatment efficacy and also help to make prediction of treatment sensitivity with a minimal invasive approach. Okay, yeah, the most common cancer types in the Gulf region are colorectal cancer, breast cancer, and thyroid cancers. So beyond the established CAR T therapies, modalities that people are trying, but the most promising ones are three. One is called TCR-T cell therapy. The other one is TIL, tumor infiltrating lymphocytes. The third one is NK cell therapy, including the CAR-NT. The mechanism that involved this, the TCR-T actually targets the intracellular antigen that presented on the MHC molecules. That will expand the so-called target beyond the cell surface. Okay. The TIL therapy, the advantage is it's a polyclonal nature, allows recognition of a broad array of shared and patient-specific neoantigens. So that will help to avoid any antigen escape. NK cell therapy is an innate pathway cell therapy that eliminating tumor cells without MHC restriction, and also has the advantage of off-the-shelf products. So those are the three that most promising platforms. I think how to build a closed-loop system is very important. That's why at Arion, we have our own GPM clear room on-site on our campus. And so we can admit patient to the hospital, we can make the cellular product right on-site and infuse the product without any cold chain transportation, minimize all these steps that involving temperature change and make the transportation time as short as possible. So I think the infrastructure and research integration is very important. If you can't have the GPM, the clear room on-site, we can adopt the hub and the spoke model, use the hub as a central production, but use a spoke site to admit patient. On the other hand, the clinical practice and safety, the whole workflow is very important. We need to build a very sustained multidisciplinary team, including oncologists, immunologists, specialized nurses, and also integrate the whole electronic health record, the EHR system, to standardize the clinical pathways so that we can monitor performance metrics and ensure rigorous protocol adherence and also regulatory compliance. That's very important. Thirdly, the patient services. We provide patients with very comprehensive education, make sure they understand the whole concept, provide them with transparent communication, addressing their questions, establish a realistic expectation. That's very important too. For patient to understand not only the benefit, but also the risk that might be involved in the cell therapy. For example, the cellular release syndrome, the ICANS, that's very, very important as well. So I think to build a very specialized, multidisciplinary, closed-loop system is very crucial and critical to provide this cell therapy in a very efficient way.